Hello, and welcome to Ask the Expert in Speech Therapy. And I'm already off to a great start. So I'm Stephanie Zavaris. I'm a speech and language pathologist working for Total Education Solutions up in the Northern California region. And I was asked to, hi everyone, answer some questions and take some questions. So I'm going to get started with that now. And I hope I can keep you active and entertained a bit. So the first question I had was, who are speech language pathologists and what do they do? So we specialize in communication disorders, different than communications majors. We are about the disorder of communication. So that could be us helping individuals to communicate. So the little toddlers learning to speak and use their language who aren't quite picking that up. Kids who have language delays, individuals with autism or other diagnoses that make communication difficult. It can be adults following a stroke or a head injury. Sometimes we work on swallowing, but for the most part, what we do is we try and enable everybody to communicate at their highest and best ability. So if they can't speak, then we're going to give them alternative means. So if that's picture exchange, sign language, if that's going to be a device that has voice output, whatever it might be, that's what we're going to do our best to try and get them to do. A question came through that I found very interesting. Somebody asked, do you think babies' language development will be affected if caregivers wear masks? I had not even thought about that. So I called one of my colleagues and got her opinion too, because she's an early intervention specialist. And we both thought, oh, we should have thought of this. And yes, we do. And short answer is yes, we do think that wearing masks would negatively affect development because so much of communication is facial expression. So much of it is just beyond eye contact. It's the smile, it's the frown, it's all that expression that comes with it, that the smile goes with the tone of voice, that goes with the words. So we do think that it could have a negative effect. There are no studies yet, which is what we would look to first, but I'm sure those would be coming out. And one of the things that we think would be appropriately recommended would be to do the full face shield for caregivers working with kids, just to have the full visual. So versus a mask that shows the mouth, it would even be better to have the whole face shown through the face shield. So that was such a great question. We hadn't really thought about that, and we are really going to have to check into that to see what our national ASHA account says for us to do, or not says for us to do, what they find in studies for that. And that would be interesting though. So yes, we do think it would have a negative effect. And so yes, we do think that face shields would be most appropriate. The other thing is, children are resilient, infants are resilient, and so the language that they receive from their parents when they're at home, that's going to help out, and that's going to be face-to-face without a mask on. So another question was, what are some speech and language exercises or activities to practice at home? So the funny thing is that a lot of it is play-based. So read a book. I once had a very sweet and kind parent say, well, he can't read, he's only 1. Well, yeah, but he can look at the pictures, and we label things and we talk about, ooh, look, that boy is jumping. You think he's going to jump up high or think he's going to stay low to the ground? So there are things that you can do while you read to ask questions, to anticipate what's happening next, and to build vocabulary. Reading, singing. Everybody knows what a shark is because of Baby Shark. That's part of the whole singing thing. And then talking about what kids are doing while they're playing. You narrate. See, it's Friday afternoon. You talk about what your child is doing as they play, as you play with them. Get on the ground and play with them. Use the same language over and over to give them an idea of what to say, and give the characters actions and what they're doing and what they can be saying. And then you're going to wait. That's one thing I think a lot of us forget. We need to wait and give them a second to think about what the word might be that they need, and let them initiate with us. So we teach them we're going to prompt them, and then we are going to wait and let them take their time to get their words out. I was talking with someone today whose 3.5-year-old client is starting to stutter a little bit, which is absolutely normal. It's totally typically developing to have a stutter that comes up. So parent was concerned, and just talking to them about waiting and letting them finish their sentence and not being anxious about that, because it's something that will come and typically go. And if it doesn't, then we would deal with that. And then follow their lead and play. So play with them, whatever they want to play with. Kids want to build forts, you build a fort. If they want to put the bear on their back and pretend like they're hunting for something, whatever they want to do, you let them lead, and then build all the vocabulary around it and give them ideas that they may not have even had about where that can go. Another question: how can family be involved in speech language therapy? So many ways. So first of all, if your child is in therapy, go into the session. When they're in the session, it's very tempting to be on your phone to return those last few emails or check in with the babysitter who's got the other kids. Put the phone down and get on the floor if that's where your child is, if he's a little guy, and work with the therapist. Therapists are like this much of it. We're good, don't get me wrong, but you are with them all the time. So whatever we do, do it at home. If you're not sure what to do it with us in the therapy room, and then we can coach you through it so that you feel comfortable, and then you can do it at home, because the more you do it at home, makes us look good because they're doing well and exceeding and meeting their goals. So therapists want parents involved because that gets them more exposure to more therapy, right? You're with them all day. Take that time to be with them. So as your kids get older, we have more specific tasks that we do, but really it's about being in the room and seeing what we're doing. So if we are asking kids to add prepositions to whatever they're describing, that's something you can do at home. Whatever it is that we're doing, you can do at home in everyday activities because you're with them all the time. And just adding language to anything that they're doing. So if your child's at a 1-word level, add one more. So now you're at 2 words. So doggy bark. Baby cry, 2 words. If they're using 2 words, baby cry, you're going to say baby cry a lot, or baby cry loud, or baby cry and sad. So you're going to attach another word to it and just kind of expand out. But anytime you are a parent and in therapy, your therapist should be thrilled to have you involved, because it gets their student, their client, more direct service time when mom and dad kick in, when they pitch in and do it with us. So you should always have the therapist be happy that you're going in. How do you know if your child needs speech therapy? So if they don't have words by 18 months, that should be a little bit of a flag that there's a delay of some sort. If they have words and lose words, that's something that would be a flag. Difficulty following directions, or like he acts like he can't hear what you're saying, that would be another thing that would make you think, maybe there's something not quite right. If your child can't be understood. So there's typical, I can't quite understand you, and there's the understanding where mom understands and little kids understands, but maybe like grandpa and grandma don't, but that's okay. And then there's, I don't understand, I'm the mom, little brother or big brother don't really understand. That is a time of concern. And mostly if your gut is telling you your child has something not quite right, go get it checked out. You can ask your pediatrician. If your pediatrician does the, oh no, we need to wait and see, and your gut is still like, I don't know about that, push. Try and get an assessment, an evaluation. There are other avenues that you can look at. So you can do that. If they're a little older, you can go to the school district and ask the school district to conduct an assessment. And that's a way to get your child assessed. But go with your gut. You know your child better than anybody else does. Listen to the professional that you trust. And if your pediatrician says wait and you're like, oh, okay, I can wait, trust your gut on that too. It's okay to wait. Sometimes it does take, in that next month, there they go, and things start taking off. So trust your gut. That being said, earlier intervention, the better. So it's always earlier to get in there and build up than to wait and have to undo and retrain. It's always a little bit harder. Another question we had was, what happens during speech therapy? Well, that kind of depends on your therapist, the areas of need, and the age of the client. So with the little ones, it looks a lot like play, because play builds language, language builds play, and they build on each other. So getting on the floor, playing with the child, providing language, giving ideas of things that kids' toys can do. So they might know car, they might know that word, but they may not know the door and the tires. They may not know that the car goes. They may not know that the car can go fast or slow or up or down or crash. Crash is always a good one. So on the floor playing builds that vocabulary, and vocabulary is the foundation. If you have vocabulary, you can manipulate it to make things make sense, put things together, build a sentence, get a thought out with language. If the child is being seen is a little like that, we're playing on the floor, parents should be on the floor too, because on the floor is where it's at. So a lot of professionals and teachers think, well, why aren't the parents playing with the children? Well, no offense to any finance people or banker people out there, but that's just not the forte, right? You guys are numbers people. It's not like playing and language is not your strong suit. So learning how to do that, don't be afraid to do that. Learn how to get on the floor and work with your kids and play with your kids and talk about language. And you have to do a little bit of mind shift to help your child, but you can. So you will. The other thing that happens during speech therapy is a lot of reading. There's a lot of language and emotion and anticipation and prepositions and descriptors that go along with reading. So reading books over and over and over. You might go into a session with your child and you may not, grandpa brought him for the next month, and then you come back in and we're reading the same book. It's okay. It's because your child is learning what the sequences of the words. Your child is learning how to read the book to me. Your child is learning that they can finish my sentence maybe before, and they couldn't do that. So repetition is something that children need, because that's how things sink in sometimes. And moving on to the next thing is not always what they need. We need to stick with it for a little before we move on. So don't get too excited if that's what's happening. As the children get older, we're going to start looking at some curriculum-based activities. So again, vocabulary is going to be a piece of that. And we're going to be looking at where they are and where they need to be as far as curriculum goes, and how we can build up to get there and scaffold their learning so that they can get up where they need to be. In general, you're going to see us teaching. We're going to teach them the skill that we want them to know. Then we're going to prompt them through it a little bit so that they do some, we do a little bit, they do more, we do a little less, and then we're going to wait. Sometimes that's the hardest part because we like to talk. So we're going to wait because it's going to take them sometimes a second to follow the direction or come up with the right answer or initiate a social interaction with us, because that's a whole another thing that adds some complexity to what we do. So teach it, prompt it, wait for it, because they need the opportunity to do it. And if we keep jumping in, they don't get that opportunity. And how does speech teletherapy look? So this has been something we've been doing as a profession, not necessarily all of us, but now all of us are. And I have to say, I've been super impressed with our staff at TES. So not to toot our own horns, but I'm going to do that for a minute. The staff here, the speech pathologists, have gone above and beyond. So my favorite, I shouldn't say she's my favorite, but what she's doing is one of my favorite things. She went to the dollar store, so it's not even that expensive, got a couple of green tablecloths, threw it up behind her. She wrapped herself in it, so it was she's a little bit of a floating head, and then superimposed pictures onto it. She joined a Facebook group, Instagram, maybe you're together. Anyway, she joined a group to talk about how to do that and how to learn those things. And so she is in a rowboat, rowing her boat, and she is dipping into the water and pulling out items that she's finding in the water. She is doing a magic hat where she puts her hand into a hat and out comes the articulation cards that the students are working on or the pictures they need to describe. And the students are so much more engaged because they're like, how do you do that? This is so interesting. And she keeps telling them, I'll tell you at the end of the year how I did all this, but you have to keep coming back to therapy because it is a challenge for them to sit and look at a screen. There is nothing that's that easy. Although we had another therapist who, we were closed for the week and weren't able to see them, and it was a insurance kiddo. And so the therapist comes back in and sets up to do online therapy, and the client was so excited to see her and so excited that he got to see her and just was like running around the house trying to show her things that he had. And so when that relationship's already been established, it's a little bit easier to continue that with a lot of our clients. Some clients can't be seen because it's not a viable way for them. And so we work with the parents to consult, to help them help the student when we can. And then when we can get back to face, we will do that. Teletherapy can also look like interactive games. There are so many things online that we can do now. I have one of my newer therapists, one of the things that she does as a movement break for the students is she will say, okay, you have 10 seconds to go find something blue in your house, go. And then she sets a timer, puts that on the screen, and then they run around the house trying to find something blue and bring it back to her within the 10 seconds or 15 seconds or however long, depending on their mobility. So they treasure hunt for a break so that they get to come back and share and describe what they found with their therapist, and they aren't just sitting and watching a screen the whole entire time. So that's what teletherapy looks like, is everybody is getting creative. They're researching online. I was talking about the differences of older therapists and newer therapists. So we older ones tend to want to create things. We don't go looking for things that have already been created because then we have to adapt them anyway, and we like things done a certain way. And so Stephanie, the green screen therapist, is creating all of her own things. She's getting ideas from elsewhere and then creating her own. My younger therapists are going online and finding incredible resources and sharing it with everybody. That's the other shout out I have to do, is that my staff has been super great communicating with everybody and sharing all that information. And then they find ways to change it or incorporate it into the therapy to address their goals that they have for their students and their clients. So it's everything. It's like anything else. It's what we put into it. And I will say that the TES speech therapists are phenomenal at making sure that what they are doing is right for their clients and for their students, and that things are being addressed properly. And we are teaming up with parents in every way possible to make sure that they can facilitate so that they can keep the student at the screen if need be. They can provide the physical encouragement, the patting on the back, the high fives. We'll do high fives like that on screen. Not quite the same thing, but when we all do it with the parent and the student and me, it's a true high five for everybody all the way around. Makes you want to do it, right? When I do that, don't you want to high five me? Okay, so that's kind of what we have been doing, is adjusting all of that for clients who are working on social pragmatic work. I'm going to say a little bit, some of them are having a little bit easier time with it because through a screen is a familiar medium for them. It's not as daunting because they're looking at my face on a screen versus my face in front of them. And so in a way, it can be a little bit easier. Transitioning back into real life is going to be the next step. But it's not, I don't feel like there's been a big miss in our being able to help our clients as we go through this pandemic situation that we're in. And I feel like it's in some ways been positive for us because we've learned how to stretch ourselves as professionals in finding out how to better help all of our clients. And so if something does occur where a student can't be seen and they're maybe like on a home hospital situation, that we are going to be much more able to provide services for them and reach out for them and make sure that they continue to be able to receive their services and their minutes that are set forth on their IEP. So I do think that as hard as this has been, and believe me, it's been hard for me. I'm very social and like to be out and talking to people. I do feel like it has stretched all of us professionally. And I think it's been a positive thing overall as far as how we are approaching therapy and our clients. And I've just been really proud of everything that's been coming out of this. So I hope that I answered a lot of your questions. I see a bunch of my people online giving me some love. So hi, everybody. Thank you so much for that. And if nobody else has questions, I talked for 21 minutes. Look at me go. All right. I hope everybody has a wonderful, safe, and relaxing weekend, because this has been a lot of hard work. And I hope that you all are able to relax and be well. Thank you so much for joining. Have a good weekend. Bye-bye.